Hello, welcome back. I'm Dr. Susie Hugely. I work with the Doctorate Nurse Practitioner program at Weber State, and I'm going to go into a little bit more detail about shock. If you check out our previous video, we described the basics of shock, and now I'm going to talk to you about the stages of shock. So hop aboard, let's go. So the first stage is called the compensatory stage. Stage 2 is the progressive stage. Then we get to that very sad irreversible refractory stage. And one thing I want you to know right out of the gate is that early recognition is key. If you have any healthcare experience and when people go into shock, unfortunately, it's not noticed until that blood pressure drops and until the patient is very symptomatic. So let's first begin with the compensatory stage. We know our body has a fight or flight mechanism that when we are in trouble, if we sense danger, that sixth sense, or if a bear's growling in our face, we either run or we fight. Okay? And so in the compensatory stage, our body realizes, hey, dude, I am not getting enough oxygen. Your brain, just so you know, from here on out, I always want you to know the earliest sign of lack of oxygen is decreased LOC. Our brain needs that oxygen. Hold your breath for a minute. Let's see how that works for you. You pass out, right? Our brain needs oxygen. So the very earliest sign of lack of oxygen is that decreased LOC. The blood pressure in this compensatory stage remains normal. Well, that's weird, Susie. If I don't have enough volume, how is my blood pressure? Wouldn't that be the first to go? No, it is not. And that's why we need to recognize that's not the first sign, that's a later sign. Because with that fight or flight, we have vasoconstriction. And that constriction is just enough to keep the blood pressure within a normal range. Doesn't mean it's up, but it keeps it up enough that it's within a normal range. And most healthcare providers don't notice that. So the blood pressure remains normal in that compensatory stage. However, the heart rate is increased to try to compensate. Blood pressure normal, heart rate increased. So if our heart doesn't get oxygen, if our brain doesn't get oxygen, it runs amok. So what happens? Our blood shunts from our less vital organs to our brain and to our heart to give them the oxygen that it needs. And so our skin doesn't get the oxygen that it needs. Our gut doesn't need to digest at that time. So our gut doesn't get as much oxygen and blood flow. So shunting of the blood to the vital organs. Like I said, the skin gets cool and pale because there's not a lot of blood flow in most categories of shock. And it can lead to that metabolic acidosis. And so one thing that we may or may not know is when I talk about that dropped pH, we need to blow off CO2 to help raise that pH. And so that is why, number one, our body says, oh, I need oxygen, breathe more, Susie. And also, oh goodness, my pH is dropping, blow off CO2. To raise that pH. So those are a couple reasons why the respiratory rate increases. And then we need to monitor for progression to the next stage. So let me give you some visualization for those who like pictures. Again, the compensatory stage, that vasoconstriction. So you see something blinking on my PowerPoint, that must be important. Blood pressure remains the same in the compensatory stage. I said it 100 times, I'll say it again. Why is that important? Why do I need to hammer that in? Because as a healthcare provider, you won't notice the patient's in shock if you're waiting for that blood pressure to bottom out. You need to look at these other things and notice them first to save a life. So that increased heart rate, the shunting of the blood, you're gonna have cool skin. Also our kidneys, everybody at the table eats first and the kidneys get the crumbs if there's any left. And so if we don't have blood flow, we can't make urine, right? That is an earlier sign too that we start to notice is the urine output decreases. If you don't have enough urine output, then you don't have enough blood flow, okay? It all boils down to peeing. Then we have inadequate perfusion. We get those shallow respirations. Again, you're trying to get more oxygen onto that red blood cell and you're trying to blow out that CO2 to raise that pH, acidosis, and then confusion. So confusion, the number one first sign of not having enough oxygen, again, friends, is that decreased LOC and that confusion, okay? Then we move on to the progressive stage. This is when things get serious. Now you're noticing the blood pressure drop, but now it's already progressed and it's harder to get a hold of. Those mechanisms that regulate the blood pressure can't compensate anymore. Your MAP, what's MAP, Susie? We don't use MAPs unless we put it into our phone. MAP is your mean arterial pressure. And all that means, folks, is how much blood flow and pressure do you need to perfuse your organs. It starts to drop, you get that hypotension, and now your mental status continues to decline. You get that acute lung injury, you have arrhythmias, can get those chest pain, your kidneys start to become impaired even more, your GI function, it's not having blood flow to it, you get that hypoxemia, and your declining mental status. So that's your progressive stage of shock. Here's your pictures for my visual picture learners. This is when you get the drop in blood pressure. You have a very thready pulse. What do I mean by thready? It's not bounding, it's not a full, beautiful pulse. It's very thready because you don't have a lot of flow, a lot of blood flow. You get that hypoperfusion to your organs. The vasoconstriction continues. It's given it the old college try, but it's not helping compensate anymore. That worsening confusion and that increased restlessness continues. It affects your lungs. Why? Because no longer are you having adequate breaths to blow off that CO2, to offload that CO2, so it's injuring your lungs. And with an injury, we all know, injure your lungs, what do you get? Edema. Now try breathing underwater through all that edema in your lungs. That's a bad day on the farm, people. We don't want that to happen. It affects your heart with those dysrhythmias continuing to go. You can go into a unstable cardiac rhythm. It affects your kidneys because no longer are you having enough glomerular filtration rate or simply pressure to make urine. Your kidneys get injured, your livers, your gut, all of those organs start to fail. And then sadly, we get to the irreversible stage of shock where the blood pressure remains low. You have that multiple organ dysfunction or failure. Your acidosis worsens. We're talking about 6.98, 6.8 something. Hopefully that made some of your jaws drop because that is not an adequate state to keep your body alive. So at this time, you just need to gather family around and say, we're very sorry, we've done all we can do. And communicating with family is key. Please communicate, please be transparent, please keep them in the loop, let them know, because if you don't, they might not have time to get other family members to the hospital to say their goodbyes or to be together as a family. So let them know, communicate with them. That is key. And so that is the end of the stages of shock. I hope it was helpful for you. Thanks again for your time, for joining us. We look forward to seeing you again. Take care.